Hi, I'm Dr. Anita Krishnan. I'm an ENT specialist with a special interest in sinus-related diseases. I practice out of Bangalore ENT Care Center, Kormangala. Ear piercing can be done by two methods. One is the traditional method of piercing with a sharp needle and then putting a gold stud. The second is by doing a gunshot. Now, both has its own merits and demerits. Between the two, I would preferably say the traditional method of using a sterile needle and doing a railroading technique of putting the earring is a better option. Now, what is the fallback of a gunshot? In the gunshot, the earring is supplied along with the gun, and it is not made of 22 karat gold. It has something called nickel. Many people can develop a contact dermatitis or allergy to that nickel. So after getting a gunshot done in 2-3 weeks time, maybe the wound can get infected for the simple reason, not because sterile precautions were not used, for the simple reason that the person was allergic to nickel and it reacted and the ear gets infected. Then the only option is to remove the earring, allow the wound to heal and then pierce it in a traditional way. The things which you have to look for after a ear piercing is that you avoid a close neck shirt which you have to pull over your head so that you disturb the pierced area. Also, you must watch that if there is any sign of redness or swelling, you should meet the person who pierced it for you. In the traditional method, what is done by the doctor is that anesthetic cream is applied for about 30 to 45 minutes, which makes the ear completely numb. And a needle is used to pierce at the right spot, and where the needle goes through, the earring is pushed from the back so that there is a tamponade or pressure so that there is no bleeding and the track is formed. The advantage of the traditional method is that we are using a sterile needle to make the piercing, and by a railroading technique, a 22 karat gold stud which has no nickel in it and therefore no chances of a contact dermatitis is passed through, and because the point through which the needle goes is tamponaded or pressure is put by the earring, there is no bleeding also, and there is no need to change. There is no chance of a reaction or infection, and if the doctor prescribes an antibiotic ointment which you apply, and life continues as normal.